So good morning, welcome to the early morning follicle fix at 6 live session dealing with everything regarding hair. And today we have a very interesting topic, a topic on the demand of many of my clients, many of my patients who want me to address the newer path-breaking treatments in hair loss treatment. For over 30 years now, the hair loss community has been, so to say, chasing shadows. Every few years, we promise our patients the philosopher's stone of follicular regeneration, a final cure that always, amusingly, is just 5 years away. Having been in the trenches of hair restoration, hair loss treatment for men and women for over 2 decades now, I have watched this charade repeating every 5 years with clockwork precision. A new molecule appears on the horizon, social media and startups light up with excitement, a few slick animations are released and then silence. All quiet on the Western Front. The hype fizzles out. No phase 3 trials whatsoever. No commercial viability, just another name added to the graveyard of failed miracles in hair restoration, in hair treatment for men and women. In all these years of over 2 decades practicing hair loss treatment in men and women, and more so hair transplant, surgical hair restoration, I have seen that only 2 treatments have stubbornly stood the test of time. DHT blockers like finasteride and vasodilators like minoxidil. Everything else has been, quite simply, all sizzle and no steak. So welcome to today morning's Follicle Fix at 6, a platform dedicated to the scientific exploration of hair restoration in an era where aesthetic medicine intersects with evidence-based practice. Understanding the complexities of hair loss and its treatments is paramount. Hair restoration is a dynamic field that combines surgical expertise with an understanding of hair biology and patient psychology. Through Follicle Fix at 6, every day morning at 6 a.m., I aim to disseminate knowledge free of any bias, free of any conflict of interest. I address misconceptions and foster informed discussions on hair loss treatments. Knowledge is power after all, and by empowering patients with information, I pave the way for confident and informed decisions in their hair restoration journey. Hair loss continues to be a psychologically distressing concern, particularly among men with androgenetic alopecia. As therapeutic strategies evolve, patients often find themselves at crossroads, whether to opt for a hair transplant today or wait for potentially revolutionary treatments like the new one in the horizon, PP405, and many other novel agents looming on the horizon. As the saying goes, a bird in hand is worth 2 in the bush, but this adage is worth revising in light of emerging science. Now, a word about PP405. Only yesterday a patient of mine told me that he's waiting for PP405 now, and he was waiting for a host of other treatments earlier. They came out in the market. He didn't use them, and because he didn't use them for long because there was no effect. And then every year he switches to new treatments which are promised as the elixir of hair loss. So PP405 is a novel pharmacological compound under development by Pelage Pharmaceuticals and has garnered widespread attention for its purported ability to reactivate dormant hair follicles. And it does this by targeting the prostaglandin pathway. Preclinical trials in rodents, murine models, have demonstrated remarkable follicular neogenesis and elongation of the anagen phase, raising hopes of non-surgical regenerative solutions. However, it remains in early phase human trials, and we are several years, if not a decade away, from definitive safety and efficacy data and the final judgment and the final word on PP405. Regulatory hurdles, formulation challenges, and unforeseen side effects could slow its path to clinical utility. And while we are at PP405, a promised elixir for hair loss, in the meantime, let's discuss some other treatments which people talk about. And number one is stem cell-based therapies. Autologous dermal papilla cell injections and hair follicle stem cell expansion have shown potential in pilot studies. However, these approaches face technical challenges in standardization, like a host of other treatments which came and went away over the years. So it has challenges in technical area, also in cell survival and follicular integration post-transplantation. Besides stem cell-based therapies, there is this exosome therapy. I would like to state that in some United States states of the United States of America, exosome therapy has been not approved because they say that it might enkindle or re-enkindle cancerous cells and could be actually harmful. Until such time more clinical data is available, they are not going to allow treatment with exosomes. So exosomes are derived from the mesenchymal stem cells, and they carry with them signaling molecules that modulate inflammation and thereby promote hair growth. Though anecdotal, whatever small scale clinical data we have is encouraging, but robust randomized control trials are still lacking, and we look forward to having more data and more long-term usage before we can pass a judgment on exosomes. And then we have the WNT pathway modulators, molecules like SM04554, which is a topical agent which you rub on your scalp, topical WNT agonist. It has shown promise in the phase 2 trial, and these agents aim to stimulate follicular regeneration by modulating embryonic signaling pathways which are involved in hair cycling. And then the fourth is gene editing. Gene editing is still a distant reality for alopecia. It holds theoretical promise for conditions with known genetic basis. However, ethical and technical constraints place this firmly in the not yet category. So it's still on the horizon, very distant horizon. And then number 5, we have nutraceuticals or botanical extracts. Products like procyanidin B2, which is a caffeine-based formulation, and marine collagen supplements show modest benefit. While relatively safe, these nutraceuticals do not reverse miniaturization and cannot substitute for definitive interventions. And sixthly and lastly, we have these JAK inhibitors. Now, JAK inhibitors have widespread usage in other domains as well. And initially hailed for alopecia areata, agents like ruxolitinib and tofacitinib are being purported and repurposed for androgenetic alopecia. However, their high cost, their immunosuppressive profile, and limited efficacy in male pattern baldness, that is in pattern baldness, makes them an unattractive option at the present moment of time. Now, given this landscape, the decision to proceed with a hair transplant remains a pragmatic one, especially for patients with stabilized hair loss and who have realistic expectations. Modern FUE techniques, when performed ethically and artistically, offer durable, natural results that last a long time. With donor area conservation and advances in extraction tools, the procedures of FUE have become safer and more refined over time. So before we take up the question answers today, I would like to conclude with the introduction by saying that while the future of hair restoration brims with promise, many of these treatments are still castles in the air. For individuals seeking immediate, reliable improvement, a well-executed hair transplant remains the gold standard, along with established treatments for androgenetic alopecia like DHT blockers and stimulators like topical minoxidil or even oral minoxidil. So one must not allow the mirage of unproven therapies which appear every 1 or 2 years and then vanish. One should not allow the mirage of these unproven therapies to delay interventions, because if you do, you will be losing precious time and your follicles which you lose are not going to come back. And even these proven therapies will not be able to work thereafter. So you should focus yourself on therapies. Yes, you can try other therapies as well, but focus yourself on therapies that are tried and tested and truthful, and which have been audited by the medical field and clinically. People, practitioners who've been in the field for a long time, like me for 20 years, who have seen their utility in treating hair loss because of androgenic alopecia. And as the scientific aphorism goes, the perfect is often the enemy of the good. And that means waiting for perfection often means forfeiting what's already proven to work. So with this, we start today's question answer session, and you are most welcome to shoot your questions, and I will try my best to answer them. So the first question is by Chad. Hello, I have watched a few of your videos. I have a question about finasteride. Do you mind? Yeah, of course, please go ahead. Till then, till such time you write it down, I'll go on to Mr. Philly Boy Fitness. Do you also suffer from hair loss yourself? Oh yes, I am a grade 6 male pattern baldness, and if you see my previous videos, I have also shown a video in which I have already done FUT procedure in 2007, and then one FUE procedure in United States in Boca Raton, Florida in 2011, and I have do good coverage in the front, but my crown area is a little thin, and I now lack donor area to cover that area because it's large area. But I don't mind it, because being a Sikh wearing a turban to work and all the time, I keep my head covered. It's not exposed ever, because Sikhs go out only with a turban, and that's what I do. So hair loss at this age, at 58, doesn't affect me much. So that answers the question of Mr. Philly Boy Fitness. What age did you start going bald for yourself? Well, I first noticed some thinning at the age of 28. But when I was 33, I started noticing that my crown area was enlarging. And whenever I used to go see my pictures, which were taken from behind in a gathering, I would notice that my crown area is enlarging. That was at 32. And then I started certain treatments like Rogaine. And I did not start finasteride at that time because there was not much clinical data available at that time for finasteride, and I think I missed that, and if I had taken finasteride, I would have been able to slow down my progression and still have had a head full of hair. But as I told you, I had got a first FUT done in 2007 in India, and an FUE in Florida in 2011 in Boca Raton near Palm Springs. So both FUT and FUE, and I can tell you everything about how a patient feels after FUT and how a patient feels after FUE therapy. So Mr. Nikesh, hi doctor, does GFC treatment help for the person who has aggressive hair loss due to androgenic alopecia, or does that treatment can make hair loss worse for those who have androgenic alopecia? See, GFC treatment is just a standby treatment. It's not the core of, it doesn't affect the actual cause of baldness, which is DHT. Unless if you're young, if you've got a family history which is very strong, and if you have visible signs of extensive baldness, And if you do not start yourself on DHT blockers and get carried away because you're gullible at this age and get carried away by all this information about products being sold and all these news of products, new products, if you get carried away by this, you will lose precious time. The only things, as I told you in this talk, that have withstood the test of time is DHT blocker and minoxidil. But GFC is just a standby treatment. You can take it along with these treatments, but if you think that it's going to arrest your androgenic alopecia or even slow it down, you're mistaken. You're being led down the garden path. Mr. Gaurav Sharma wants to know, good morning, Dr. Saab. What are your thoughts on PRP, GFC and mesotherapy? That's what I told you. They are adjunctive treatments. They are not the core treatment of androgenic alopecia. Mr. Booms is a regular now. He says, can taking 2.5 milligram minoxidil tablets at the same time equal the effects of 5 milligram? Yes, of course. Why not? If you're taking it at the same time, it's the same as taking 5 milligram tablet. But why would you like to take 5 milligram tablet minoxidil? That's quite a bit. I think if you take it, you'll feel dizzy if you take it during the daytime. But if your doctors recommended you 5 milligram, please take it. But take it at night so that when you go to bed, even if your blood pressure drops by a few points, you don't feel dizzy. Mr. Chad wants to know, I saw that you mentioned that you wouldn't prescribe oral finasteride to someone who deals with anxiety and depression. I do suffer from that, but I want to take oral minoxidil and finasteride. Yeah, the answer to that is you can have a trial session. You can go ahead and take it for about a month. But before going forwards, seek consultation with a doctor in your area. Get your tests done to rule out hypogonadism, because these are the people who are prone or already have sexual side effects, low libido, erectile dysfunction. So we do not want you to be blaming finasteride for these problems. I'm not talking about you, I'm talking about generally speaking. So get yourself tested for total testosterone and total estradiol. You don't need to do DHT levels, anything else. We just want these two levels. You come out with these and then I'll guide you in what to do further. But at all times you have to take keep your doctor in confidence. Philly Boy Fitness, if you're 60 years old and a Norwood 2, do you think you can still go bald later in life? No, I don't think so. Many times Norwood 2 is not a grade of baldness. Though it is listed as Norwood 2, it is a normal setback of the hairline as you age. And even when you're 25, if you have only Norwood 2 which is stable, you're not likely to go in for extensive baldness unless family history of baldness is rampant in your family. Then that is another thing. But if you're 60 with grade 2 baldness, you are not going to have, I'm not even going to use this word likely, you are definitely not going to have baldness in the later years. Mr. Gaurav Sharma, sir, since you are yourself suffering androgenic alopecia, you should start motivating bald people on self-acceptance and self-love. Yeah, I do that all the time. And I tell them that if you're confident with yourself, there's no point going in for a hair transplant. And a hair transplant is only resorted to if you have a problem with self-image, self-confidence. There are many people, Mr. Gaurav, who do not come for a hair transplant. They are quite okay with hair loss and baldness. Almost like I would say 80% of people or more than that who have the money for a hair transplant and who have heard of hair transplant do not get into hair transplant because they are quite at peace with their self-image, and there are other things they think that are more important than just hair. So I do not force people to go in for a hair transplant. I tell them the pros and cons, and I tell them how it's going to progress as it would without keeping anything. There is no conflict of interest in my consultations, and that's why I charge a fee for consultation. Harshul Kaul wants to know, how do all the Bollywood stars have head full of hair despite being on bodybuilding steroids for years because of Finax? See, Bollywood stars, a lot of Bollywood stars I have experience because I have a clinic in Mumbai and I manage a lot of hair loss treatment in Bollywood. And I have seen that they use a lot of fiber. Secondly, they use patches in the crown area if they run out of grafts. Do not go by what Bollywood stars look on the screen. That is not how it is. And if you want, I can send you some pictures which were taken by paparazzi of certain top Bollywood stars who were on vacation with hair which is completely low in density. Yeah, Bollywood stars are very hesitant in taking finasteride. They put a lot of powder mostly, and it's all a illusion. We think that they have a head full of hair. Probably they've gone to a top-notch hair transplant surgeon who does not show himself. It's not so. Mr. Chad, so the anxiety isn't as much an issue as the possible erectile dysfunction. And what test should I get my testosterone levels? Total testosterone level and total estradiol or estrogen level. Anxiety is an issue because, see, it is all in the mind. Side effects are in the mind. And if you're an anxious person, especially with obsessive compulsive disorder, every time you go into the internet and check for side effects of finasteride, you are surely going to get a side effect because the brain is the most powerful organ in the body. And that's why I say that people with OCD are not candidates for finasteride. And if they want to try, like you insist that you are anxious, you can take a trial of 4 weeks to 6 weeks and see for yourself whether you can tolerate this medication. Next one is by Booms. I had great hair like 2 years ago, but moving for a year made me thin crazy. I also had very bad sleep pattern. Can this be reversed by medical therapy and healthy lifestyle? Yes, if the hair is still thinning, if the hair is not thin to such an extent that it's miniaturized, the hair shaft diameter is still more than 50% of normal, lifestyle changes and medications can definitely reverse your thinning. But if you've developed baldness, if the follicles are atretic, that is almost gone, there is no way medical treatment or lifestyle changes are going to be of any use. That is the time when hair transplant is usually resorted to. Philly Boy Fitness. Can you have retrograde alopecia without male pattern baldness? No, not likely. Retrograde alopecia is a severe form of male pattern baldness, and it is only seen when patients first manifest baldness patterns in the front or in the crown area. Gaurav Sharma, please share the pictures of these Bollywood stars. Yeah, I cannot do it right now here, but if you come to my clinic, I can show you the pictures. Sharing somebody's pictures, private pictures, is not a good thing. But if you search these Bollywood stars on the internet, you're surely going to find them because they are all over the internet. You will surely be able to find them. Harshal Kaul. Can we take both oral and topical minoxidil for better results? No. There's no point taking, there's only a, see, when you cross the threshold of a medication, it does not start, it plateaus. The dose response curve plateaus after a particular level of the medicine in the blood. Taking it in greater dosage, like applying minoxidil more than once or twice in a day, or applying 10% minoxidil, the dose response curve has already been achieved. You're not going to benefit more from increasing the dosage or the timing, the interval. It's only going to give you side effects and no benefits. So please do not take more medication than is allowed, than is recommended to you. Harshul Kaul. Yeah, so that is the answer to your question. So next question, Philly by Fitness, do you perform a hair transplant on Norwood 2? Yes, of course. For hairline, we routinely perform hair transplant for Norwood 2, and it requires about anywhere between 1,000 to 2,000 grafts for Norwood 2, depending upon where you want the hairline, how far back your temple points have receded, and what is the density you're looking at, and how much is, of course, the donor area available. HG, I think he's come for the first time. I hope you've subscribed. In case I want to try finasteride for a month and I get sides, all of those reversible or should be concern for any permanent side? So if you have been counseled properly by a doctor, if your lab work has been done properly, you've been tested for any other organic condition is ruled out, and if you have gone on a trial phase for 4 to 6 weeks and nothing happens, you're not going to have any side effects even later. but you have to follow my strategic treatment interruption protocol, that is a switch off, switch on technique. And this will hold you in good stead by keeping your side effects at bay and keeping you healthy, at the same time allowing you to sport a head full of hair as per the objectives that you have before starting yourself on these treatments. So seek a consultation and get a doctor to write a prescription, which is a doctor who is well conversant with hair loss treatment. Philly Fitness. If your sides of your hair is thinner than the top, is that normal? No, that's not normal. That means that you have what is called as diffuse pattern alopecia or diffuse unpatterned alopecia, and this needs to be corrected before you go in for a hair transplant. You can send me pictures, you can send me a link here to your Google Drive to the picture, protected by password, and I can answer you. If your sides of your hair is thinner than the top of it is normal, I've answered that. Chad, if I can't take oral finasteride, then is topical finasteride an option? Also, with oral minoxidil will oral minoxidil cause me issues with anxiety, and is oral minoxidil better than topical? See, I really do not think that topical finasteride ever works. I tell patients who take topical finasteride to go off topical finasteride for a month, and they are surprised that they didn't have any hair fall. So they started using topical finasteride, and they thought that their hair loss had stabilized because of topical finasteride, which it didn't. In the normal course of time, their baldness had stabilized, and they were just applying topical finasteride just for the heck of it. Oral finasteride is the only treatment presently available for treating hair loss, and it has been there with us for over 30 years now. It's a proven treatment, and we know its side effect is the spectrum of its side effect and utility. It is the only drug which cures progression of baldness. So if you can't take it, try environmental factors, try minoxidil. Minoxidil can cause little palpitations and anxiety if used too much in a great dosage. Oral minoxidil is definitely better than topical minoxidil. Yes, topical minoxidil 10% is not safe because it causes dizziness. There's dizziness at work, and also it can cause headaches and can cause you to lose concentration on your work. It does not in any case benefit you more than 5% because the dose response curve flattens out after 5% used once or twice a day. Philly Fitness. Does retrograde alopecia happen in person only, Norwood 3? I would say that retrograde alopecia starts to appear when signs of extensive baldness, grade 5, grade 6 and grade 7 begin to appear. Not before that. Clinically, I have seen that. There could be odd patients who might have retrograde alopecia even with grade 3. But commonly, patients with extensive baldness, grade 5, grade 6, grade 7, early thinning when we also notice that there is a pattern developing at the root of the neck. Patient's lower hairline at the back is moving up. So it is, I have noticed this. This is my clinical observation. There is no paper published on this. Booms, can men in early 20s expect more hair growth with finasteride? And how much time is needed for regrowth or thickening of miniaturized hair? Yes, at the age of 21, when your body has matured, you can start finasteride. And of course, in 4 to 6 months' time, one hair cycle, you will get a good growth with finasteride, provided you're taking it in the adequate dosage and you're taking it at the right time. After 6 months are over, these results can be sustained for a long period of time, provided you follow the strategic termination of treatment, strategic treatment intervention technique or switch off, switch on technique, so the body does not have so much of this drug that side effects happen, or the body does not start, or the finasteride does not develop tolerance. Body does not develop tolerance against finasteride. So you have to be careful how you take the medication, how you start the medication, and how it is supervised by a doctor. So we'll have to end this now. If you have diffuse pattern outline of Norwood 5, but still have a lot of hair. Does that mean without medications you will eventually be a slick bald grade Norwood 5? Yes. You just need a trigger in form of either stress, some illness, taking whey protein. Stress can be dietary stress. Stress can be stress of migration to a new place. Stress can be because of not sleeping normally, not following the sun cycle. Stress comes in various forms, and it can happen overnight. Nikesh, my doctor prescribed oral finasteride 1 milligram and topical minoxidil for 6 months, and then told me to stop, but my aggressive hair fall not yet reduced. I was not sure why he told me to stop. There's no point stopping DHT blocker there's no point starting DHT blockers if you got to stop it in 6 months. These are medications which are taken in the long term. This is not cough and cold that the doctor is treating. He's up against genetics. So unless you continue to suppress DHT levels, your baldness is going to continue to progress. You may suppress it for 6 months, but then once you stop it, in 30 days to 45 days time, all the hair which was maintained because of finasteride are going to be lost. You're going to go back to square one. Is diffuse pattern common in men? Yeah, nowadays it's becoming more and more common. A lot of patients come to me for hair transplant, but they have some miniaturization, a lot of miniaturization in the donor area, and this confirms with diffuse pattern alopecia, and they are not candidates. They are candidates only if they start treatment to make their donor area more robust and stabilize the baldness, stop the progression of baldness. So that is the end of the talk today. If you have any questions, do let me know. Leave a comment in the comment section after this goes online, this video. Last question from Chad. I am in contact with hair clinic Turkey called whatever. They told me that I was Norwood 3 scale with a slight vertex and would need 3,800 grafts for full restoration. This seems excessive. It all depends upon the size of your head. Grade 3 vertex may also take 4,000 grafts. So it all depends, but I don't know which doctor. Turkey, I don't know, Turkey or mostly all technicians, they've got laid down set protocols of how many grafts according to the chart to advise to patients. So I cannot say this. Unless it's a doctor's clinic, a doctor with a reputation, I would not really, I would take it with a pinch of salt. So thank you for watching. I will again meet tomorrow. If you have any questions, leave them in the comment section once this video goes online. Have a nice day. Thanks for watching.